what we're going to do, and it's a version of what we've done before, but is we're going to have these particular investigators give you a little capsule summary of their area of research and maybe their collaborations supported by BCRF, put it in context, and hopefully that'll both educate and stimulate some additional discussion and questions both among us and among everybody who's here in the audience. One thing to just point out is that any of the investigators that we named who are here with us today and those who aren't could be here on the stage, and the talent is just remarkable. Not only that, many people in the audience could equally answer the questions that might be posed, and we may call upon some of you right from the stage to do just that. We'll see how the day goes and how much we want to surprise some of our colleagues. So, with, again, no further ado, Judy, why don't you spend the first couple minutes and tell us a little bit about your BCRF-supported work.
So, the first time I was called DeAndrea, and I should just be careful because Alan DeAndrea would be very surprised to know this, and also Miles Brown, who actually is my husband. So I've been fortunate to be funded by BCRF for some time, and I've worked largely in hereditary cancer risk, so in the genetics of breast cancer. And the funding from BCRF has always allowed us to try and generate some early data on the next question. So to let you look ahead, see where you wanted to go, and collect some preliminary data so that you could get the bigger grants to do the full project. And we started out studying BRCA1 and BRCA2 and P53 genes that give tremendous risk of breast cancer to women with strong family histories. And we have, with our colleagues in this remarkable Boston community, been able to collaborate to help some of the more basic scientists like David Livingston and Alan DeAndrea to study what BRCA1 and BRCA2 actually do. And from learning with them, we were able to think about whether women who had inherited breast cancer might have tumors that behaved a little bit differently because they came in the setting of a BRCA1 or BRCA2 gene. And not only the breast cancers, but the ovarian cancers. So we'd work with Dr. Matalonis to think about some of that. And we stole from the ovarian cancer group in a project that really, truthfully, was born at a BCRF meeting in New York, where several people sat around, as people do at night, after the dinner, before the luncheon of the next day, just talking science, because there's this entire room full of people thinking only about breast cancer. And we talked about whether the fact that BRCA1 and 2 were genes involved in the repair of errors in the DNA could be exploited by particular medications. And so we started our first trial looking at platinum in the treatment of breast cancer. And platinum is not a drug that was used in breast cancer very much. And because of the work of the BCRF and the funding that we started with, we were able to translate some of the early progress into funding in a SPORE grant, which is a big grant from the government that puts together people all working in breast cancer at multiple institutions in the Boston area. So many of the names that you heard have been part of these projects. And because we had some success in those projects, we've been able to take them further. And my current project is with Nadine Tung from Beth Israel and our collaborators Stu Schnitt and others. And I'm sorry if I'm forgetting anybody's name. But to look now on a study around the country at 9 centers to look at whether platinum is a better drug for the treatment of women with the inherited form of breast cancer than standard drugs. And it may be and it may not be, but the trial will help us to know this. And we could not be where we are without BCRF.
Great, thank you very much. I just have to say, for all of you who don't realize it, and I say this frequently, most of the time we get to use PowerPoint, and it makes it much easier for us. That's why we have PowerPoint. You all think that it's so you have something to look at, but it's really just to keep the speaker organized. So doing this freehand without notes is always impressive to me, and so thank you, Judy.